Motion passed. Mandatory Provident Fund Schemes Mandatory Amendment Bill 2014. We now resume the second reading of the Pharmacy and Poisons Amendment Bill 2014. Chairman of Bills Committee, Dr. Joseph Lee, would make a report on the deliberation of the Bills Committee. As Chairman of the Bills Committee on Pharmacy and Poisons Amendment Bill 2014, I would like to report on the deliberation of Bills Committee. The purpose of the bill is to amend the Pharmacies and Poisons Amendment Bill and subsidiary legislation to implement some of the recommendations made by the Review Committee on the Regulation of Pharmaceutical Products in Hong Kong, so as to better regulate the safety of pharmaceutical products in Hong Kong. The Bills Committee held 9 meetings, and also there was a meeting to receive views from deputations and the trade. I would like to report on the number of the issues raised at the Bills Committee. First, to empower the board, the board to issue the Code of Conduct and Codes of Practice for providing practical guidance to register pharmacists and drug traders. And if they do not comply with the Code of Practice, they may be subject to disciplinary actions. Some members are concerned that the proposal provides the board with too much power, and whether the administration is trying to circumvent the scrutiny of LegCo on the formulation or revision of those codes. The administration has explained that there are 3 individual sets of codes of ethics promulgated by the Pharmacists Association to govern the professional conduct of the members, while the board has introduced a code of practice for authorized sellers of poison in 1997. The code of practice carries no legal status. There are currently no codes of practice for other drug traders. It is thus considered necessary for the bill to empower the board to the flexibility to draw up or revise the codes with regard to local circumstances changes, and the administration would consult the trade when the codes of conduct or codes of practice are to be amended. And the proposed requirement of placing drug orders in written form may affect the operation of trade if it is put in the code of practice. Although the pharmacists are in support of this, the doctors' associations are against this. They are of the view that if the drug suppliers keep the orders in writing, that would serve the same purpose. According to the good practice promulgated by the Hong Kong Medical Associations, doctors should keep the order after placing an order by fax or post, so as to verify the delivery and supply of drugs. The proposed approach by the administration would accept that other forms of electronic records can be kept to fulfill this requirement. And many drug suppliers have come up with standard purchase forms to save the time of their clients, and some of the drug sellers would have indicated that this will not result in any delay in the delivery of drugs. And also the qualification requirements for AP, authorized persons. The committee notes that for a person who is not a registered pharmacist, then after taking a course in pharmaceutical poisons and pharmaceutical industry and poisons and other courses recognized by the board and have 3 years of experience in, then he will be maybe an AP. The Bills Committee discussed in length on how we can ensure that the AP has the relevant ability. the administration has stressed that diversify and accompany the nature of the manufacturing of pharmaceutical products. The qualification required for APs also need to be diversified, and but of course, one of the qualifications will be pharmaceutical qualifications. This is in line with international practice such as the EU. Some members of the view that the regulatory framework for registered pharmacists, covered pharmaceutical products, traders, and the board's power is too wide. Some members of the view that the regulation of pharmacists should be carried out by the professional body. They want the administration to set up another statutory body to take over the functions of the board. The administration has explained that the main purpose of the bill is to implement some of the recommendations of the review committee. The administration has set up a steering committee to look at the manpower planning and professional developments for the healthcare personnel, and also the long-term professional development of 13 allied medical professions. And there was an in-depth discussion of the Bills Committee that about the definition of ASP, pharmaceutical products and drugs, and also to recover the costs of conviction of drug traders, the revision of the quality control of production, and also to the format of making available registers and information for public inspection, and also the requirement to keep samples of pharmaceutical products. I won't repeat the details as is set out in the report. We have no objection to the proposed CSAs from the administration. Well, I've just read out a very overly written report. That this bill, the review committee was set up in the wake of the safety incidents of pharmaceutical products in 2009. There are 75 recommendations. Some 60 orders have been implemented administratively, and now we are talking about other amendments implemented through legislative amendments. For example, placing an order by telephone. Now it requires something in writing. In the discussion, some professionals are of the view that this is too troublesome. So we held more meetings than we had expected. I have to raise issues of concern of my constituents. In 2009, after 2009, the review committee made certain recommendations. 16 were about legislative amendments. There has been a strong call that the board should not be asked to regulate both the professionals and the drugs. The Secretary should review this situation as he promised to the Bills Committee. Should pharmacists be subject to the regulation of the board, or should there be a board for people, for the practitioners, and another one for drugs? But the professions and trades would like the administration to honor its promise to do this in future. Other amendments are of technical nature. I won't explain them in detail. I urge members to support those amendments.
Mr. Cheng Hapan, the administration proposed the Pharmacy and Poisons Amendment Bill 2014 with a view to strengthen the regulation of drugs in Hong Kong, to build a better regulatory regime for regulation of drugs in Hong Kong. This will help to enhance the standard of the pharmacy industry, pharmaceutical industry, and the DAB therefore supports that. As said by the chairman of the Bills Committee in 2009, there was many cases of drug incidents. Say, for example, a manufacturer the drug of a manufacturer caused the death of 8 patients. The administration in 2009 March established the Review Committee on Regulation of Pharmaceutical Products in Hong Kong, proposed 75 recommendations. The administration adopted the recommendations. Some of the recommendations had to be implemented by law. The administration therefore moves the present amendment bill. There are 5 major issues in respect of the bill. Now, the party concerned asked the administration to set up a separate regulatory body for registered pharmacists. As said by the Bills Committee Chairman, the PPB, the Pharmacy and Poison Board, is responsible for licensing, drawing up codes, and enforcing the law. The PPB has full control of all the registered pharmacies. The parties concerned doubtful whether the starting point was drug safety. Instead, it's just for convenience, administrative convenience. In May 2014, the administration said that the proposal would be considered by the steering committee on review of medical healthcare, manpower planning, and professional development. Now, the present amendment is to implement the recommendations by the review committee, and legislative progress should not be hindered. We accept the explanation. The bill also authorizes the PPB to issue code of conduct and codes of practice. There are groups which oppose the promulgation of codes by the PPB because it can amend the code without going through legislative procedure. And members of the PPB, the representation of members is not wide enough. There should be more participants from the relevant sectors to make sure that the board is evenly represented. The administration is of the view that giving the regulatory body to issue codes is a common practice, just like the broadcasting ordinance. The board has to ensure impartiality. Too many members will only undermine the system. There are 11 members of the PPB representing 2 pharmaceutical professors nominated by universities. The trade can nominate 3 pharmacists. In drawing up the code, there is high transparency. Information are made available to the public. The participants include the consultative body, include representatives from more than 40 bodies representing the trade. The DAB agrees to the representation of the board, but there should also be a voice representing the business sector so that SMEs representatives can give their views. The bill also require the licensed manufacturer to employ at least 1 AP to raise the standard of pharmaceutical products to make sure that each batch is in line with GMP guidelines. Some groups are of the view that if the bill is passed, then the gatekeeper will be given to a person who has the academic qualification. It seems that it is just lowering the standard of regulation. Because of the complexity of production and the production process covers different disciplines, the professional knowledge of pharmacists are rather specific, and they may not be able to understand the whole production process. The authorized person arrangement is reasonable. That is based on similar requirements in the European Union. A person who holders of manufacturing authorization are required to have the relevant university qualifications and also working experience. The AP system is able to implement suitable quality assurance so that GMP can be effectively promoted in Hong Kong. The fourth theme of the amendment bill is that all the poisons under Schedule Part 1 has to be put in locked containers and is not accessible to customers. The key should be kept by registered pharmacists. Some groups are of the view that a pharmacist is just an employee. If he holds the key, then there may be a conflict of role with the employer. The owner owns the regulated medicine, not the pharmacist. That is taking away the ownership of the goods. But in fact, the arrangement has not changed, as said by the administration. As for all ASPs, they have statutory responsibilities to make sure that all Part 1 poisons can only be sold by a pharmacist or sold under his supervision. When an ASP breached the registration ordinance, the pharmacist will not be held responsible. If there is a need for the ASP to obtain the medicine, then that can be done under the supervision of the pharmacist, and that doesn't take away ownership. The DAB contacted the trade and discussed with the trade the premises of the ASP. The administration regulates the arrangements through the code, and it will not be limited by this bill. As mentioned in passing, according to the review committee, in the code, the proposal to require placing medicine by written order has the objective of maintaining a complete set of record in order to reduce the chance of making mistakes in ordering of medicine. That provides a better protection. Giving the requirement of ordering medicine by writing will help to prevent abuse, and email and other means of electronic means can also be allowed. The purpose of the bill is raise pharmaceutical regulation in Hong Kong. This enables the administration to better regulate pharmaceutical industry and maintain safety. That has balanced the interests of the citizens, the retail sector, and also the pharmaceutical sector. The DBA supports the proposal.
Mr. Ellis Mack. President, I rise to speak in support of the passage of the Pharmacy and Poisons Amendment Bill 2014 and the proposed CSA from the administration. First of all, I'd like to thank Dr. Joseph Lee for leading us in the 8 months of deliberation and doing all the coordination. I also thank the cooperation rendered by the officials so that we can have this bill passed to enhance drug safety for drug users. I hope the CSAs will pass smoothly so that the patients, concerned groups, and other people can sign a sigh of relief. As Dr. Joseph Lee and Mr. Chen Han-pan, the bill is the result of a spate of pharmaceutical incidents in 2009. Some people were killed directly or indirectly by the pharmaceutical incidents. The government, in the wake of the incidents, set up the review committee on the regulation of pharmaceutical products in Hong Kong, and the review committee make a number of recommendations. And in this bill, we are implementing 16 of the recommendations that require legislative amendments. So there are good grounds for making the amendments, and it's good for drug users and patients generally. There was a public hearing conducted by the Bills Committee, and we have also received views through various channels from stakeholders. We have meetings with different organizations, including pharmacists associations and drug traders. The traders are particularly concerned about giving powers to the Pharmacies and Poisons Board to formulate and revise codes of practices. They think that too much power will be given to the board, and the Bills Committee spent a lot of time in receiving the views. For example, the proposal to require placing drug orders in writing, and there were a number of discussions. I support very much the proposed provisions of placing drug orders in writing. This may make it inconvenient to doctors and drug suppliers. What they need to do is to change their habit. But compared with the inconvenience caused to doctors and drug producers, we should bear in mind the need to keep it safe for patients, because if the order is placed in writing, then the chance of making mistakes will be minimized, and drug safety will be enhanced to benefit the patients. And also, if should there be a pharmaceutical incident, for example, a wrong drug is prescribed, that would allow us to trace the source of the mistake. And if the records are kept in writing, the relevant parties cannot shirk their responsibilities, and the patient will be able to pursue the responsibility. Therefore, because of the principle of safeguarding patients' interests, I'm in favor of incorporating this requirement in the code of practice. Some members have raised other concerns. For example, the definition of pharmaceutical products and recovery of costs in case a party is convicted of wrongdoing. Some deputations told us to shelve the scrutiny of the bill. It shows that there's been problems with consultation with the stakeholders and other associations, and there's room for improvement on the part of the administration. Since the review committee came up with the recommendations up to the introduction of this bill, people had the impression that there were a lot of slippage, and therefore the trade was very worried, and they reacted negatively and strongly to this bill. The pharmacists associations have offered many the opposing views, because many of the amendments would have an implication for their professional development and their future operations. We understand their concerns, and the representative of pharmacists actively indicate to us what they thought should be done. They have provided us with a lot of information based on their expertise, and it was very helpful. And some patients groups also asked us to complete the scrutiny quickly so that the bill can be passed to enhance drug safety for patients. And we were urged not to drag the feet, but we should not just speed up the scrutiny and do it quickly. The process might be slower than expected, but we do show the responsibility to ensure drug safety and safeguard the interests of patients. Although the preparation work had room for improvement, I appreciate the positive attitude expressed by the administration and the effort to coordinate the parties' views. At first, it was proposed that at any time when the pharmacy is in business, then a registered pharmacist must be on the spot. And the trade reacted very strongly to this because of the limited supply of registered pharmacists, and they may not be able to recruit. But this idea was given up by the administration in the light of the response. So, the officials were not there just to sell their ideas, and they are willing to do more to move things forward. Of course, there may be the view that the government succumbed to opposition views. I hope after the bill is passed, the administration would conduct timely reviews on the requirements. In the future, we'll continue to monitor drug safety and the development of the pharmaceutical industry. We will urge the administration to enhance communication with the trade, for example, in particular when the code of conduct or codes of practice are to be revised. The board should take on board views of the stakeholders. The trade and the professional body should be contacted. We should work together to enhance drug safety in Hong Kong and the professional developments of the trade. I support the bill and the CSAs.
Dr. Leung Ka-lau. Thank you, Mr. President. I heard our colleagues say a lot about ordering of medicine or pharmaceutical products in writing. We argued a lot and many times in the Bills Committee. I don't know why there were such arguments. In fact, this is to regulate the manufacturers who are to supply the medicine at the request of doctors. In fact, purchase in writing is not in the bill. The administration said that in the future codes, it would require the manufacturers to do so. So after so much argument, whether or not you agree to the proposal, we cannot make amendments now to change the proposal for purchase in writing or placing orders in writing. Well, if the administration does not have this requirement, then the manufacturers don't have to require orders to be in writing. So after so much argument, we arrived at nothing. Ordering in writing, can it enhance the safety of medicine? One doctors' association was very much in support of that. Another was strongly against. I told them it's very easy to place an order in writing. In my clinic, I don't know whether this is the case. The nurses do all the things. In fact, the doctor only has to put a chop on it. And then I asked those who support order in writing. I asked them whether that will enhance drug safety. They could not come up with an answer. Ordering is ordering. When the medicine is delivered to the outpatient clinic, it may be different from what's on the booking list because some medicine may not be available or out of stock. So the actual quantities are actually on the delivering note. And then the clinic is to put a chop on that invoice. So if you rely on the written invoice, it would be proper. In order to combat illegal sale and purchase of medicine or drugs or pharmaceutical products, we're actually afraid that we don't know where the medicine or pharmaceutical products will go. So we should attach importance to the actual quantities delivered. What's in the original order doesn't matter so much. But since there's so much controversy, the government made a concession. I don't know whether that's a concession or that's the original thought of the government. So what's meant by in writing? It can be by facsimile or handwritten. We've used fax machines a lot, but an order can be in writing. Say, after going through the fax machine, a dot on the handwritten order may disappear. So 5 and 50, 5 may become 50. So will this affect drug safety? Apparently not, because facts, documents may be read wrongly. But what about verbal order? Even if if there can be a recording, so verbal orders can also be all right. So to place an order in writing is actually a waste of time. So my speech may also be a waste of time as well.
Dr. K.K. Kwok, Mr. President, the Civic Party supports the Pharmacy and Poisons Amendment Bill 2014. You may recall that the incidents, the bill was too late. In 2009, there was a series of drug incidents involving unregistered pharmaceutical producers. There were certain urinary drugs affected by molds, and the drug supplied by a company is not in line with the description on the package, and there are drug companies selling the unregistered medicine. There are various incidents involving drug producers, and the drugs are unstable, and another company sold drugs contaminated by molds, and another company sold unregistered drugs, and another company supplied unregistered drugs to the hospital authority. These incidents may just be at the tip of an iceberg. Now, the media has reported that when an ordinary person goes into a local pharmacy store, you don't need to present a prescription. You may just spell out your symptoms, and then the person at the counter, that maybe they are dispensers but not pharmacists, they will easily give you Part 1 poisons. Some citizens shouldn't have taken these Part 1 poisons because they may be allergic to these. And some patients may have, say, diabetes, kidney disease, or hypertension. These patients may be taking other medicines. If they buy drugs without any supervision, then they may suffer from higher risk, or they may even become a tragedy. With regard to the incidents in 2009 and also before 2009, and also the repeated sale of dangerous drugs by pharmacies. Young people can buy cough syrups from local pharmacies. They can buy sedatives or other kinds of psychotropic drugs from local pharmacies. Now, can the present amendment bill tighten the regulation of sale of medicines? Although I support the amendment bill, I don't have much confidence. If we just rely on the present amendment bill, the bill cannot change what I described earlier, in particular at the level of the local pharmacy. We asked the administration time and again to raise its supervision of local pharmacies, including increasing the number of inspections, doing more undercover operations, and instigate more prosecutions. Registered pharmacists should be present at the pharmacies at all times to ensure that the sale of medicine is done properly. In fact, the administration has asked the groups to give views. The pharmaceutical departments of the two universities are similar to that of the Civic Party, and that is to ask the administration to tighten regulation, require the presence of pharmacists to be present all the time to supervise the sale of medicine. In the Amendment Bill 2014, there is no such requirement. I hope the Secretary can respond and explain why the administration doesn't do it. And if they don't do it now, when will they do it? The amendment covers 4 areas: the overall regulation of the producers, regulation of importers, regulation of retailers. As for overall regulation, the bill makes reference to the definition of pharmaceutical products and medicine adopted by the European Union. And the term covers any substances administered to humans to restore, correct, or modify physiological functions, so on and so forth. If we make reference to a higher standard of the EU, we will be able to raise the pharmaceutical industry, the level of pharmaceutical services in Hong Kong, and we will be able to keep pace with international standards, and we'll be able to raise the standard of our pharmaceutical products. The bill also authorizes the PPB to draw up a code of conduct, codes of practice for pharmacies, importers, exporters, retailers, license holders, so on and so forth. According to the law enforcement by the DFH, and also the efforts the DFH put into law enforcement, I'm worried that even if the bill is passed into law, the DFH may not have enough manpower and resources to enforce the law. When we put questions to the administration on matters related to the Dangerous Drugs Ordinance and also Pharmacy and Poisons Ordinance, we were given numbers which are worrying. The number of inspections, number of undercover operations has not increased over the years. We put the same questions to the previous secretary. We asked whether the DFH didn't have enough manpower to do inspection. The administration didn't reply. The LegCo will not be mean in providing resources. The LegCo is willing to provide more resources to beef up inspections so that the majority of our citizens who rely on primary healthcare service be fully protected. The bill has strengthened the standard of the trade or the industry. The administration has given the undertaking. I don't know when they will honor that. Now they say that they will set up a separate body to regulate registered pharmacies and enhance the accountability and democratic functions of or nature of the board or of the regulatory board. Now the present regulatory regime lacks the participation of frontline pharmacists, and the pharmacists have expressed their dissatisfaction. The proposals made by the board were not able to represent the views of the trade. Like other statutory bodies, the administration has not opened up the composition to allow the trade to have greater participation. Say, for example, in the Medical Council, as for the Medical Council, the administration insists not to have members to the Medical Council to be elected by doctors. In fact, the administration just just appoint like-minded people to the boards. As for the regulation of authorized persons or AP, a pharmaceutical product manufacturer is required to appoint at least one AP to ensure the quality of the products. Now, this is a controversial issue. The AP is the qualifications of AP is opened to those who have studied microbiology, toxicology, organic chemistry, and so on and so forth. We understand that many pharmacists have concerns about this. This opening up of the requirements may change the whole AP system and even reduce the quality of service, the standard of service. The administration said that it was in line with the European Union. But there are still questions hanging in the air. And the answers given by the administration are not able to address concerns of the deputations who came to give their views at the meeting of the Bills Committee. The administration should adopt a more stringent approach in setting the standards and qualifications. There should be a mechanism to deal with the APs. Say, for example, there should be a review mechanism. Registered pharmacists should be allowed to check whether the APs are able to meet the requirements of the registration system. As for the regulation of importers, exporters, and wholesalers, the bill deals with licensing of non-poisons. There are many importers and wholesalers or exporters who do import pharmaceutical products and medicines from different countries. If the bill is extended to non-poisons, that will enhance the regulation of the so-called non-drug products, non-poison products.
必須要處方咧，就可以喺一啲社區藥房咧可以買到。
Now these products are available in community pharmacies or local pharmacies. The raising of standard will help to improve management of medicines. As for amendment of Schedule Part 1, poison, requiring extending it to all pharmaceutical products, covering poisons and non-poisons. This will enable the authorities to more effectively deal with drug incidents. Now, in fact, such incidents occurred in 2009. In 2009, unsaved pharmaceutical products required a lot of time to be taken down from the shelf. Doctors, patients, media had to do a lot of tracing and tracking before the source could be found. And in the process, there were concerns that patients would continue to consume substandard or contaminated medicines. I hope that the regulation of non-poison medicines can be upgraded. As for regulating the retailers, the storage of Schedule 1 poison is further regulated to cover all poisons under Schedule 1, and they have to be put in locked containers, and the key is kept by a registered pharmacist. That is necessary. The administration has not responded to the call that all medicines have to be sold under the supervision or by a registered pharmacist. Many pharmacists say that though they keep the key, they are not able to guarantee anything, because when they are not in the pharmacy, the owner or other people may have access. Now the pharmacist is held responsible. They may be subject to disciplinary action, but other people are able to have access and sell these poisons. The administration, therefore, has to work along this direction. Finally, whether written orders is a must. I think in today as well, and with the current level of regulatory standard, it is difficult to oppose written orders. And written order includes fax and electronic messages, such as WhatsApps and others. There isn't any difficulty in this regard. After the passage of the bill into law, I hope the administration will work along this direction and raise the drug management standards of Hong Kong. Thank you.
Mr. Vincent Fang. Mr. Deputy, I rise to speak to object to the Pharmacy and Poisons Amendment Bill 2014. I oppose to the resumption of the second reading of the bill, but I hope patients and drug users will understand my point. I'm not against improving the regulation of the sale of drugs, and that drug users should be subject to proper safeguards. But this bill is a bill for the sake of legislation, and the bill cannot serve the legislative policy intent of legislation. And before and the bill and after the bill was introduced, the administration did not consider the reasonable views expressed by the stakeholders. The government insisted on its own way. And then the bill will allow the courts to override the law. I oppose to the resumption of the second reading of the bill. This should only be done after the bill has been improved. And what I am saying is not just applicable to this bill. There are many bills with a good legislative intent, but when the bill was introduced, the legislative intent was neglected. So, in such a way that the bill would regulate not the wrongdoers, but innocent stakeholders. And let me say something about the background of the introduction of this bill. According to the administration, we need to introduce the bill because in early 2009 there was a series of drug or pharmaceutical incidents. And what are they? They included drug manufacturers with manufacturing problems. I agree that we should better regulate the pharmaceutical production. What is more serious is that in a private clinic, the dispenser make a mistake the doctor did not know, and that lasted for a long period of time. As a result, a patient died. Therefore, in March 2009, the government set up the Review Committee on the Regulation of Pharmaceutical Products in Hong Kong to conduct a full review on the existing regime for the regulation of pharmaceutical products. The Review Committee published its report in December 2009 with 75 recommendations. Then nothing followed. But 4 years after that, in 2013, at the meeting of the Health Services Panel, the Secretary claimed that the relevant stakeholders have been consulted on proposed legislative amendments. And apart from some of the proposals, such as placing drug purchasing orders in writing, all the others were supported by the stakeholders, and that a bill will be introduced in 2014. But the panel did not have any chance to discuss with the administration the bill. And the bill was introduced without any discussion. And along the supply chain, the importers, wholesalers, retailers, and other stakeholders told me that they have strong views. And some of the proposals were considered not feasible. For example, An authorized seller of poison in selling the controlled drugs must only do so in the presence of a registered pharmacist, and the key should be kept by the pharmacist. And when the pharmacist is not in the pharmacy, then business must be suspended, and other products cannot be offered for sale. But although a pharmacy will usually engage a pharmacist, the pharmacist will work for 8 to 9 hours. But the business hour for the pharmacy will be something like 10 to 12 hours. And there is also a lack of qualified pharmacists, and many of the pharmacists are engaged on a half-time basis. So how can the pharmacists carry on with their business? The trade expressed such views to the administration. The administration listened, but did not accept their views. So it's a case of hearing but not listening, as some lawyers have pointed out. And therefore, at the Bills Committee, I asked for a public hearing to be conducted. At the meeting, even individuals invited by the administration to support the bill, including academics and government hospital pharmacists, agreed that there was a shortage of registered pharmacists. And they also expressed doubts about the representativeness of the Pharmacies and Poisons Board. And the administration did not inform the members of the PPB when it revised the Code of Conduct and Codes of Practice that the exercise was conducted to tie in with the tabling of the bill in 2014. Although the organizations were set to be consulted again before the bill was introduced, but this is just a superficial exercise. And the administration then asked us to pass the bill first. And the stipulation on leaving the key to the pharmacies will not be enforced for the time being until there are an adequate number of registered pharmacists. How ridiculous. And when after the discussion, only the proposal to ask that the key be left with the pharmacist will be taken out. So what is the legislative intent of the bill? So it's not actually achieved. The wrongdoers will continue to be left off the hook. The trade asked me to conduct a public hearing because they were concerned about their business. If they hadn't done so, the bill would be submitted to this council without any amendments. So it was done behind closed doors. After the blue bill is drafted, it would be very difficult to get amendments incorporated. So is that a problem with the DOJ, or is that the officials thought that they will lose face if amendments are allowed? The bills is supposed to regulate the trade, and all stakeholders will be treated fairly and protected. There should be no bias or favoritism. Now we allow administrative codes to override the law, because according to the bill that will receive the second reading today, the PPB will be given new power to regulate the codes. It can revise the codes. It can penalize parties who do not comply with the codes. There was already a review of the codes last year. During the deliberation of the Bills Committee, I asked whether the draft of the codes could be scrutinized by the Council or the Bills Committee. The request was turned down. The trade was told that it would come into effect on the 2nd of January this year. At that time, well, the bill wouldn't have been passed. So that means the administrative code would override the law. The Secretary would say that the code will always be there. So I think members know the answer, whether it's true that the administrative code will override the law. And now we are in the final stage of the legislative process. I am just one member, and even with the votes from the Liberal Party, I don't think I can turn the table now. And of course, there are good proposals in the bill. For example, the validity period of clinical tests will be extended from not more than 2 years to not more than 5 years. That's convenient, more convenient for drug manufacturers. And that will shorten the time for a new drug to be marketed. And that's good for patients. I believe members will support this particular proposal. But I hope to put on record the remarks that I've just made, and I certainly hope the Secretary will seriously consider my arguments. This bill would impinge on many stakeholders, and the Bills Committee completed its scrutiny within such a short period of time. A major reason is that the administration would like the legislative process to be completed to tie in with the promulgation of the code. But there are many outstanding problems. So I'm of the view that this bill is not really ready for the second reading. So I oppose to the resumption of the second reading of the bill, and I'm not going to vote on the CSA to be introduced by the administration. So I submit, Mr. Deputy.
Mr. Wong Yuk-man. Sorry, the speaker is not coming through. The review committee in 2009 was set up in March of that year to have a comprehensive regulation of drugs. 75 recommendations were proposed for improvement. That's in December 2009. It is proposed that the ordinance, the regulation, the listed sellers of poisons, etc., should be amended to enhance regulation. To enhance drug safety and protection of public health, we support the amendment bill. However, I have to point out that for this stage of second reading, half or actually 80% of the relevant associations are opposing most of the proposed amendments. Well, Mr. Vincent Fang spoke at length on these. Now, this is rather controversial. In particular, there's controversy on placing orders in writing. According to paragraph 17 of the report, the request to place orders in writing would be included in the codes for the authorized sellers. That is, for purchasers like private practitioners, there should be orders in writing before delivering the drugs or medicine. In order to avoid mistakes made during verbal ordering, and for the sake of keeping good records and tracing the drugs, most associations were opposing the proposed amendments, particularly those on placing orders in writing. It's highly likely that this bill will be enacted today in this council, but I think the administration should consider the views of the industry. A few months ago, the chairman of the Association of Western Medicine Practitioners said that he was very concerned. I won't dwell on the details. Most professional bodies expressed their opposition to the amendments. But then in the administration's paper, it said that the majority of associations support the administration. In fact, at the moment, most doctors place their orders by telephone because they can have direct communication with the manufacturers. They can opt for other manufacturers. The newly proposed measure may affect patients' interest because most telephone calls are recorded these days. So the new proposal is actually redundant. Not just the Western medicine practitioners, the pharmacists are also strongly opposed to the proposal. At the moment, 25 manufacturers satisfy the GMP. Signing by an authorized person is required, and that authorized person must be a registered pharmacist. If the amendments are enacted, all non-professionals or ordinary staff members of the manufacturers can sign the orders. The quality or qualifications required of an authorized person may not be registered pharmacists, so long as the person has completed the training program required by the standing committee and have certain prescribed experience, it would be all right. Registered pharmacists should be the final gatekeepers. We are now in the stage of second reading. In the Bills Committee, I told the administration that there are fundamental differences between the two major professional bodies. This proves what Mr. Vincent Fang said just now. The administration would like to do this expeditiously, and all along the style of the government is to go it alone. It did not try to resolve the discrepancies among the profession. To empower the board, the PPB, to promulgate the Code of Practice and Code of Conduct, I'm worried about abuse of power, because Code of Conduct and Code of Practice can be promulgated by them. In responding to individual issues raised by the professional bodies and individual professionals, nothing was mentioned about excessive power. The administration only said that the discussions should not block the enactment of this amendment bill. The PPB will have unlimited powers to impose licensing requirements, temporarily suspend licenses, or revoke licenses, or even issue warning letters to the so-called offenders. Even if there is an appeal, the penalty can be implemented concurrently without having to wait for appeal results. So the PPB has legislative as well as judicial powers. I think the regulation of drugs and the regulation of persons should be separated. And if anybody is convicted of any offense, the administration can collect, test drugs or pharmaceutical products or other substances in terms of investigation. And the administration can chase after the person concerned for the fees and charges incurred. Well, this is actually a duplication, because pharmacists and manufacturers may suffer a very heavy burden. This is inconsistency and against the rule of fairness. even for convicted persons related to drugs, they don't have to pay for the laboratory fees. Besides, there are already penalty provisions in our laws, so we should avoid double punishment. The government should not just consider the costs of the cases involved. The government should strike a balance between costs and penalty. Many portions of the amendment bill are not supported by the profession. I can even say that opposition has been strong, but in terms of enhancing drug safety and protection of public health, it is necessary to enact this amendment bill. I have to reiterate that before implementing the bill, that is, before making amendments, you should obtain more support from the profession and the industry. After the enactment of the bill, where and when appropriate, there should be reviews, and you should communicate more with the professions and the industry, because most amendments are actually targeting the operations of the industry. If you don't do that, even after enacting the amendment bill, you won't attain the effects that you want. It may even be counterproductive. With these remarks, I support the second reading of the bill. Does any other member wish to speak? If not, I now call upon the Secretary for Food and Health to reply. The debate will come to a close after the Secretary has replied. Secretary for Food and Health. Mr. President, first of all, I'd like to thank Dr. Joseph Lee, Chairman of the Bills Committee, all Bills Committee members, as well as the colleagues of the Electoral Secretariat for their hard work, such that the scrutiny work of the Pharmacy and Poisons Amendment Bill 2014 could be completed. The bill was introduced into Electoral in March last year. The Bills Committee convened 9 meetings. The main purpose of the bill is to amend the Pharmacy and Poisons Ordinance to implement the recommendations of the Review Committee on the Regulation of Pharmaceutical Products in Hong Kong, published in December 2009. There were altogether 75 recommendations. We would like to enhance the scope and breadth of the regulatory regime to prevent any recurrence of pharmaceutical incidents. Of the 75 recommendations, 16 require amendments to ordinances and subsidiary legislations. Therefore, we commissioned a consultancy firm to conduct an assessment study on the impacts. After consulting the PBB and the stakeholders, we propose to adopt most of the 16 recommendations. We will try to minimize the impact on relevant parties. We'll also proactively monitor the other aspects and in a timely manner implement regulatory measures. Apart from reviewing the ordinance and the regulation, part of which being outdated, we also propose other enhancement measures to echo social aspirations. Manufacturing, dealing, selling, etc. would be regulated in order to protect public health. As the supply chain of pharmaceutical products cover many sectors of the community and involve regulatory details, we're grateful to the members of the Bills Committee for listening carefully to the concepts behind our proposals, purposes, and detailed information. They are cautious in striking a balance between public health and protection for the industry. The Bills Committee supports our amendments. In the main, there are technical amendments and textual amendments in the CSAs. Here I'd like to briefly introduce the main amendments. First of all, the bill proposes to amend the definition of pharmaceutical products in Section 2(1) so that it is in line with the international definition. That is, it is a substance or combination of substances presented as having properties for treating or preventing disease in human beings or animals in the hope of protecting consumers. A new 4B is proposed to empower the PPB to publish a code of conduct and a code of practice in terms of pharmacists, registered manufacturers, wholesalers, retailers, and dealers can be regulated in their activities. Besides, we'd like to take this opportunity to update and clarify those contents in the regulation for temporary suspension or revocation of licenses to ensure that the law enforcers will be empowered to temporarily suspend all sorts of licenses. When the Bills Committee discussed the proposed Code of Conduct and Code of Practice, we explained to the Bills Committee the existing mechanism under the PPB, and when we revise the codes, we'll consult the relevant stakeholders. Just now, some members mentioned the consultation exercise as well as the drafting of the two codes. Here I'd like to respond to some of their remarks. As I mentioned, when the PPB promulgates the codes, the stakeholders will be consulted. Since 2012, working groups were set up by the board to invite the industry and stakeholders to participate and to provide advice on the codes. For example, in January 2012, a working group was set up covering trade associations, pharmacies, dispensaries, and pharmacist representatives, and a public consultation exercise followed to collect more views from pharmacists, doctors, dentists, trade associations, other stakeholders, and consumers. And in August and September 2012, together with trade associations and stakeholders, meetings were convened. We collected the views and analyzed them and revised the drafts. The whole process was open and transparent, and according to Clause 6 of the bill, it must be gazetted that the revised codes should be published with commencement dates. Letters will be sent to licensees on the promulgation and revision of the codes. This recommendation is in line with the provisions in Cap 329. Many existing laws empower the authorities to promulgate codes of practice and conduct. Same for broadcasting industry, insurance industry, and so forth. Therefore, we empower the PPB to promulgate and revise the two codes after referring to the practice of other regulatory bodies. Some members mentioned the setting up of another regulatory body to regulate registered pharmacists. They mentioned some concerns. Here I'd like to point out that under the existing laws, the Bills Committee noted this proposal and pointed out to the House Committee that this is not the purpose of the amendment bill. As I said, the purpose of this bill is clearly to implement our improvement measures in accordance with the advice of the review committee. Anyway, this recommendation was passed to the steering committee on strategy development. And in 2014, a meeting was convened to discuss that. will continue to liaise with the professions and will welcome further views from the industry. In regulating the manufacturers, the bill proposes to amend clause or section 21 to regulate the packaging of drugs such that they comply with the GMP and will not affect drug safety, efficacy, and packaging will be exempted to reduce the impact on the industry. The bill also proposes to amend Regulation 31, 33, and 35 to require manufacturers to ensure that products carry details, registration details, and on any receptacle, a label should be added to list out the batch number as well as the usage method as well as expiry date. An amendment to Clause 33 requires the manufacturer to keep a sample. Some bills committee members said that to keep expensive samples may involve expensive costs. Therefore, we'll move a CSA to amend the proposed amendment to Section 33 such that after satisfying certain requirements, the manufacturers can have flexibility in the retention of samples. I'll give you more details in a moment. The review committee mentioned recommendations for registered manufacturers. Will propose that under the regulation a new 30A to 30F be added to provide that every licensed manufacturer should employ an authorized person to be responsible for the quality of drugs with specified qualifications, and a list of such persons be kept such that when it is discovered that an authorized person is no longer capacitated to do the job, he should be delisted. The Bills Committee was concerned about the qualifications of the authorized persons. We clarified that the qualifications required is not to relax the qualifications for authorized persons, rather is to enhance the manufacturing standard. This is in line with the EU standard. We would like to interface with the international standard to absorb overseas manufacturers so as to enhance our GMP standard. As for enhancing the regulation on import and export of drugs, it is proposed that Section 25 and Section 26 should be amended to govern wholesaling, and the licensing regime should cover pharmaceutical products as well. That is, even for non-poison products, even though the hazard is lower, the storage and handling of non-poison pharmaceutical products may affect public health. So the new regime will cover poisons and non-poison pharmaceutical products and will replace the existing licensing regime. In order that we can trace the problematic products, we also propose to amend Section 28 of the regulation to require all wholesalers to keep transaction records, which should carry more particulars about drugs. As for packaging, size, batch number, and so forth, they should also be regulated. As for Section 28A of the ordinance, in terms of the licensing mechanism, the new mechanism will replace the existing registration system for importers and exporters, such that manufacturers, importers, and exporters will be covered by the same regulatory regime. In order that drugs are more properly stored, we also propose to amend Section 19 of the regulation such that the authorized sellers have to act in accordance with that provision and standard in the storage of drugs. Schedule 1 of the regulation will be expanded to all the poisons in Schedule 1. We also propose in 2.1 and 10.11 an amendment of the definition of authorized sellers so that the retailers will also be covered. We explained to the Bills Committee that this is purely technical in nature. It will not impact on anybody, including the registered pharmacists employed by authorized sellers, thus leading to legal liability. Besides, in order to enhance the deterrent effect, we propose to add new 34A to empower the court to issue orders covering sample taking and expenses incurred. In order to pursue the expenses incurred, the proposal is compensatory in nature. To reflect that intention, later we'll move a CSA to amend payments made under that provision should be civil in nature, rather than a penalty or a fine under our criminal laws. In order to expedite the registration of pharmaceutical products, the bill proposes to repeal the listed drugs regulation. And under the new 2A, there should be a new Schedule 10 under the new regulation to collate and simplify the regulatory procedures. And a new 21(9)B should be added such that the LegCo can adopt the negative vetting mechanism to scrutinize the further amendments to the Schedule 1 so as to impose suitable regulatory control on drugs. We also propose to amend Section 15 of the regulation on sales restrictions and prescription drugs or drug under supervised sale should replace the word poison to avoid confusion. Otherwise, people may think that the pharmaceutical products are harmful to human beings and should not be used. We're also concerned about clinical certificates with a 2-year validity period. Usually, such tests cannot be completed in 2 years. So 36B is proposed to be amended in the regulation to extend that to 5 years, such that researchers can focus on clinical experiments to enhance our R&D ability in drugs. We'll strictly surveil the new regulatory regime to enhance test safety. Many members were also concerned about the placement of drug orders in writing. I have to say something. First of all, I have to clarify that some members actually knew that that was not a recommendation of the review committee. This is just to prevent drug incidents. Verbal orders may enhance the risk of mistakes, and written orders are effective methods to avoid such mistakes. And comprehensive records can be kept to reduce mistakes made in the course of order placement and delivery. In 2007, a code was already published in this regard to enhance the surveillance and inspection of drug ordering and delivery. All registered practitioners should follow the GMP. Written orders are supported by many professional bodies, including the pharmacists and patients. In November 2013, the EU also published a set of manuals to regulate the placement of orders. Written orders will avoid mistakes made in verbal orders and will be able to trace the order flow for drugs. The European standard also asked for the keeping of ordering and delivering records. Just now, some members pointed out that written orders won't be confined to paper orders or facsimile orders. It should cover all electronic records, for example, those by emails, WhatsApp, and so forth. And these requirements will also be implemented in stage in accordance to the risks involved. In the initial stage of implementation, dangerous drugs, antibiotics, and drugs in Part 1 of Schedule 10 may also be covered. We'll then extend the regime to drugs of lower risks. For example, drugs not in Part 1 of Schedule 10. With this description, we can see that the amendments proposed by the bill are for the purpose of enhancing the regulation of pharmaceutical products in Hong Kong. As many members mentioned, this exercise involves the interest of many stakeholders in the industry, so certain contents of the bill are controversial. Some members said that nothing came forth in the interim. I have to point out that on the 18th of November 2013, we explained to your panel on health services the proposed amendments. On the 10th of December 2013 and the 10th of February 2014, the panel held another 2 meetings. And deputation and individuals were invited to add their views. Most of them supported the proposed amendments. Here, I'd like to reiterate one point. The proposals here do not represent our comprehensive proposals for the whole workflow and not covering the whole regulatory regime. Most amendments recommended by the review committee did not involve legislative amendments. So the remaining recommendations had been implemented in phase and gradually. These amendments in the amendment bill require legislative amendments. That's why we're putting them in the bill. As for the differences in views in the industry, of course, the proposed amendments will add certain work procedures to the workflow of the industry. But I think we should consider patients' interest at the end of the day. Convenience and facilitation of the industry should not override patients' interests. Some members were concerned about the enhancement of law enforcement. I have to emphasize that this is not within the scope of the amendment bill, and all along in the Department of Health will enhance law enforcement, and where necessary will have increased resources to cope with law enforcement. Therefore, as I pointed out just now, for all the proposed amendments in this exercise, they aim at enhancing the regulation of the industry. We duly consulted the stakeholders. We might not be able to absorb all the expectations of members or all the concerns of the stakeholders. We might not be able to satisfy everybody. But as a result of the concerns of the industry, we made some adjustments. We're grateful to the Bills Committee for its support for the proposed amendments. Many organizations repeatedly said that they support the bill, which would enhance the regulatory regime to give better protection to patients' interests. I urge members to support and enact the bill.
I now put a question to you, and that is the Pharmacy and Poisons Amendment Bill 2014 be read the second time. With those in favor, please raise your hands. Those against, please raise your hands. I think the question is agreed by a majority of the members present. I declare the motion passed. Pharmacy and Poisons Amendment Bill 2014. Committee stage. Council is now in committee. Members may refer